Hello, my name is Brendan Connell. I'm an oncology physician. I specialize in genitourinary cancers or urologic cancers. I wanted to talk today about hormonal therapy for prostate cancer. So we've been using hormonal therapy for a very, very long time. I believe it was discovered about 1942, and the doctor that discovered it won the Nobel Prize. So we've been using it for many, many decades. So what are we talking about when we talk about hormone therapy for prostate cancer? So if you have the prostate cancer cell, and this can be in the prostate, it can be in a lymph node or in a bone, no matter where it is, it depends on the normal male hormones testosterone to survive. So what happens is that testosterone floating in the bloodstream is taken up into the cancer cells, and once it's taken up, it causes that cell to grow and to divide and to multiply. So I call that testosterone the fuel, the nutrition that cancer cell requires to survive. So when we talk about hormone therapy, we have two ways that we go about it. We can either block the action of testosterone or we can lower testosterone. So we call it hormone therapy, but more accurately, we could probably call it anti-hormone therapy. So we have the two ways that we do this. Typically, blocking the testosterone comes in the form of pills. The most common that we start early on is called bicalutamide, or the brand name Casodex, although there are many others. You might recognize them by that MIDE. The drugs that end in mide are often the drugs that block testosterone. And actually, even more commonly, we use injections. The most common injection that we use is Leuprolide, and I've used the brand names Eligard and Lupron. These come as either intramuscular injections on the backside or subcutaneous injections under the skin. And they can come in all different forms. It's usually a depot injection, slow released. It can be a 1 month or a 3 month or even a 6 month shot. And the length of time that you pick for that shot and the length of time that you're on hormone therapy is unique to your prostate cancer story that you decide with your doctor. Rarely we do use surgical removal of the testicles as well as a way to lower testosterone. It's called a bilateral orchiectomy. Not used too commonly, but it achieves the same effect. So how does life look when you're on hormone therapy? So from my clinical experience, having given this to hundreds of men, I usually say it's about 50-50 what I see in clinic. About half the men do really well, sometimes no side effects or minimal, and the other half have what I call nuisances or bothers, or, annoyances. It's pretty rare to have truly, really poor quality of life, but what are some of those possible annoyances? So I described 3 categories of hormonal effects. The first, the real side effect there that I talk about is fatigue, and this can manifest as decreased stamina, decreased endurance, decreased motivation, just a little bit harder to get up and go or to have a long, busy day. Not that you're laid up in bed, anything like that. So that's the general category. In the second category here, the hormonal category, so hot flashes are here. Many men experience these. It's very similar to how women get these symptoms during menopause, having that warm, sweaty feeling across the brow. More often it happens at night than the daytime, usually lasts for a few minutes. I'd say most men get 1 or 2 of these a day. Certainly a nuisance, but not dangerous. Also in this hormone category, there are the sexual side effects. This is usually twofold, that with decreased testosterone, the libido or the drive, the sexual interest or thoughts are just not there anymore. And then if we were on these shots for long enough, or if it's combined after a surgery or with radiation, oftentimes there's a decrease in erectile function as well. So you'd be talking with your doctor about sexual side effects. I talk in the third category about long-term health effects. So testosterone's a hormone. It's there for metabolism. It's there for a reason. What are some of the possible longer-term issues with having low testosterone? So one, testosterone is helpful for bone density. So it's possible to have slightly weaker bones. So you're often on a calcium or a vitamin D supplement, and we check bone density scans down the road. Because of the slower metabolism, it's possible to have some weight gain. Some men notice that they put on a few pounds. It's often around the waistline. And so you definitely want to be talking about diet and exercise. Some men notice a decrease in muscle tone. The medicines don't cause you to lose the muscles, but it can make it a little bit tougher to maintain them. So some of the bigger muscle groups sometimes are not quite as strong over time. There's this emotional category where sometimes men feel that their mood is a bit lower or a bit more irritable, or I'll often hear that from their partner. So that's something we look out for. Very rarely there can be cardiovascular side effects. It's at very, very low percentages. Usually it's people who are already had some form of heart disease that are predisposed to it. And then there are some cognitive side effects, whether it be decrease in concentration, ability to read and keep your focus. For people who are maybe 80 and older who are on it for the very long term, there can be some memory issues. These last two, the cardiovascular and cognitive, are really quite rare, but possible and something that we'd be monitoring together. Again, so a number of things that are possible, but if we go back to the first thing I mentioned, about half the men do really, really well and notice minimal side effects, but those are some of the possibilities. So again, we have pill form to treat this, injectable form, and that's a quick introduction to how hormone therapy works, what we're trying to achieve, and some of the side effects. Thank you very much.